Hello, and welcome to the Preceptor modules created by the Professional Development Department of the College of Nursing of Michigan State University. Module 1 covers the role of the preceptor. Today's activity will provide 0.25 contact hours of continuing nursing education. And we are able to do this because Michigan State University College of Nursing is accredited with distinction as a provider for nursing continuing professional development by ANCC. Completion criteria for this continuing education activity is participation in the learning activity, achievement of 80% or greater on the post-session test, as well as completion of the post-session evaluation. These will be available to you via a link as well as a QR code at the end of the presentation. Again, this module is covering the role of the preceptor. My name is Catherine Kowalski. I'm an assistant professor and nurse planner for the College of Nursing at Michigan State University. Let's first start by defining what it means to be a preceptor. A preceptor is somebody that demonstrates competence within their own professional practice that then guides, assesses, validates the knowledge and skill and attitudes that are needed to really transition in a new role and practice. The preceptor plays a unique role in personal and professional development of a novice nurse. A preceptor can guide the student in real-world practice by allowing them to try those new skills while gaining confidence and validation. I think it's really important to start off by understanding your and reflecting on your own experience as a preceptor or within your preceptorships. So I want you to think back to preceptors that you've encountered in your own nursing journey. Were these positive experiences? Were some experiences maybe not as fruitful? What did you think of your preceptors and their ability to teach you or guide you? What did you think of their approach? Now I really want you to reflect on yourself. How would you act as a preceptor based on your past experiences? Would you model any of these things that you've encountered or change practices or approaches based on what you've seen? I think this is a really great starting point to kind of understand what you bring to the table as a preceptor. So there are many different preceptor modules or models within literature, and I'm really going to discuss Dr. Ulrich's model of preceptor roles and competencies that outlines 7 domains. So to help you better understand more on the responsibilities of being a preceptor, I really want to dive deep into each of these domains to help, again, better prepare you for the impact that you have on nursing education. The first component of Dr. Ulrich's model is role modeling. The preceptor acts as a role model who can influence the development of safe nursing practice habits within novice nurses and student learners. So how do we ensure safe nursing practice? Well, we can do this by modeling professional nursing practice in everything that we do as preceptors. We know that the clinical environment can really vary among instructions and units, and by demonstrating correct nursing practice by following hospital policies and procedures and guiding our practice through evidence-based research and findings will help model your student correct and sound practice. Preceptors who display congruent nursing practice when they follow evidence-based guidelines and hospital policy. And congruency between what you say as a preceptor and how you perform a nursing task is really important to minimize confusion for a novice learner while integrating learner's integrating that theory of critical thinking skills within their professional practice. Teaching and coaching, and this is the kind of blend of the science of teaching and then the art of teaching. So teaching provides the opportunity to enhance and expand on knowledge. Well, coaching allows the preceptor to really take teaching to the next step. It's more than just learning a skill. It is teaching and coaching how to use a skill and or that knowledge most effectively within practice. So how do you do this as a preceptor? Well, there's kind of a stepwise approach, right? So we need to acknowledge the learning needs, identify any learning experiences, and provide a safe, non judgment learning environment. Create a controlled learning environment that allows for opportunities and pace time for your student. Provide clear instructions to the learner and ensure that they really understand what you've instructed. Safe practice begins when you're making sure that everyone understands what the expectations are. Encourage the student at the start of the preceptorship to always ask if something is not clear to them. Observe their practice. Watch them do their assessments. Watch them complete the skills. Listen in on conversations that they have with patients and families. This is how you, as a preceptor, better understand their competency and development of skills. Allow for time to the student to reflect on their own experience. Right after they complete a skill, allow them the time to kind of really sit with that. How did that go? Debrief, and then provide feedback. A preceptor works in collaboration with faculty, clinical educators, and unit leadership to really facilitate the teaching and coaching. Being a facilitator. Facilitating is really creating that rich and inviting learning space. And how do you do this? You help find, negotiate, and create those learning opportunities and in creating that environment that you want the learner to be guided through. So at the beginning, a preceptor may need a preceptee may need a little bit more facilitation, but as they advance on throughout your clinical experience with them, they can start to kind of assume some of the responsibilities. Experiential learning really requires intentional planning on behalf of the preceptor. You really have to create the environment, the experiences, and the opportunities for students so that they can really grow in their learning and understanding. Being a protector. This mainly is rooted in the foundation of safety, both safety for your preceptee, but also for your patients, right, and the outcomes. And this is truly done by oversight of your preceptee. And this is making sure that you are validating, you're assessing, you're validating their skills and knowledge, but also really observing that in practice and making sure that they are using safe practices, one, to protect them, but also to protect the patient as well as patient outcomes. Being a socializer. Socialization really is defined as kind of the integration within a social group through process of learning and adapting in a new role. A novice nurse or a learner may feel really nervous about making good impressions with coworkers, or learning how to navigate the systems within the hospital, or even speaking up within the medical team. A preceptor can really facilitate socialization by introducing the new nurse to other care members of the team, explaining formal or informal expectations of the role, facilitating connections with hospital councils or systems, and influencing care team members by accepting and supporting the new staff member, the new nurse, the new student. Leading and influencing. The preceptor really needs to understand and embody the role of a leader. The ANA Scope of Nursing Practice Standard 11 really talks about how a registered nurse leads within the professional practice and practice setting. And leadership does not always necessarily translate to kind of that authoritative role, but rather it focuses on the influence of the role of the preceptee and preceptor relationship. And influence can look like a couple different things. Allyship. It can be win-win scenarios. Understanding the preceptee's goals, concerns, their needs. Relationship building. You can lead and influence through demonstrating your values. And the ANA recognizes values in nursing such as compassion, presence, trustworthiness, diversity, acceptance, and accountability. Being an evaluator. An evaluator provides valuable formative and summative feedback. And objective feedback, you really want to be providing feedback based on your observations of the progress or lack thereof, and it really assists in growth of the preceptorship program and participate in kind of that ongoing evaluation and quality assurance. And evaluation really is rooted in three main components. You have to be specific, you should be timely, and then you need to be constructive within your feedback. And if you want more information on feedback, as well as advanced feedback strategies, there are 2 other modules in this series that really dive specifically into those key concepts. So, how to put this all together? One thing I wanted to outline for you is kind of some practice application strategies of how to really bring these roles and components into your role as the preceptor to make you more successful. So let's talk about role modeling. What does this look like as a strategy for you as a preceptor? Well, again, it's rooted in that modeling of professional practice, again, supported by your evidence-based practice. So prior to completing a skill such as tracheostomy care, make sure you're directing the learner and going yourself to ensure hospital policies follow guidelines that are evidence-based, right? Teaching and coaching. So while caring for a patient with diabetes, really ask your learner open-ended questions to really assess their understanding of the insulin administration. Do they understand dosing protocols? What is an appropriate site injection? What are side effects? What are patient education needs? As a facilitator, a preceptor can really help utilize this in practice by allowing and encouraging students to really actively participate in interdisciplinary rounds. Allow them to be the one to report off to the interdisciplinary teams, especially if it's a team-based reporting system. Allow them discussions with physicians, pharmacists, and other healthcare team members to really make them comfortable within the interdisciplinary team. Be a protector. You can do this by ensuring safety of the patient and the learner by oversight of skills and procedures, such as a peripheral IV insertion, graduate students doing suturing, or wound care practices. Socializing. Making sure you're doing those introductions for the learner to all healthcare team members, such as physicians, your support staff, and then encourage them to really participate in unit routines such as the huddle and or other patient care activities. As a leader, you can really demonstrate values such as accountability and trustworthiness by displaying this within your clinical practice, and then that encourages the learner to really develop this within their own approach to care. And then as an evaluator, really offer constructive feedback that highlights both strengths and areas of improvement. Collaborate with the learner then to develop a personalized learning plan to address any identified learning needs. Lastly, we developed a self-assessment check tool outlining all of the roles of Dr. Ulrich's model. And I think that this is really valuable to really, again, reflect on yourself as a preceptor, your past experiences, but then what do you bring to the table for your student learner? Where are areas that you are stronger? Where are areas that you really might need some practice or to focus on before taking a student or a novice learner? You can also ask trusted advisors for feedback, and they can kind of help you identify strengths and opportunities. And they can also maybe identify some resources or some action steps for you to take to kind of gain the knowledge or improve your skill. This assessment tool is available as a PDF file and downloadable on the main module webpage. The last thing that I wanted to include here for you is this video created by preceptors that really speaks to the heart and the rationale of why people choose to precept and the impact that it can have on your own professional growth and experience in professional practice. So I'll allow you the time. This is linked here in the video, in the presentation, as well as outside of the module for your own time to reflect on this. This concludes the information for the role of the preceptor module. Thank you so much for your time and attention and joining us today. Here are the references for the presentation. On this slide, you will find the link as well as the QR code for the post-session test and evaluation. Scan the QR code with your phone or click the link provided. Your continuing education credit will be provided electronically following your successful completion of the post-test. Again, 80% or greater. You have multiple attempts, and then that will, once you have successfully passed, it will take you through to the post-evaluation survey. You'll provide your feedback as well as an email address, and make sure that that email address is where you want your certificate sent. Again, once you have submitted the post-test as well as evaluation, you will receive your contact hour certificate to your email directly. Thank you again for joining me.